Away. The chair now recognizes Representative Cherfilus-McCormick for 5 minutes for any questions she may have.
Thank you so much, Chairwoman, and thank you so much for your testimony. It's truly an honor to be here listening to your testimony. I do have a background in home health also. I am second generation, and I kind of miss being in there and finding solutions to these problems. And I do believe also that community care is imperative to serving our veterans. However, we do need to have bipartisan legislation that can help us fill in those gaps. So I was very delighted when I heard what Dr. Hunter was talking about, the need for standardization as far as to make sure that we have accessibility, but also communicating what is going on with the community care doctors, specifically getting on-time or real-time information for our patients, which even in the private side and community care, we're still trying to get up to date. So I wanted to talk to Dr. Hunter a little bit more about that. What recommendations would you put in place so we can actually bridge that gap, specifically when it comes to community care and our veterans offices?
Thank you so much for that question. As we said, we know community care is vital, but we know there needs to be better direct communication so that patients are receiving that same quality, integrated, coordinated VA care that leads to better outcomes. And so if we look at recommendations that can improve this, one is having the same types of care standards that are required for community care providers as for VA healthcare providers. This is seen very clearly in the mental health area, where when a patient is seen internally to VA direct care mental health providers are required to set a evidence-based course of care for that patient that hits very significant benchmarks that are there. When they're referred out to the community, they were referred out for a time-based episodes of care, so 6 months, 12 months, and then it's reevaluated. But right now, there is not a requirement to actually share back with the patient care team what the decided course of care is. And in fact, all that's required is yes, this patient showed up for an appointment and it's either improving or not improving. So first and foremost, to strengthen this is to set the same standards for evidence-based care for VA care and community care and require that transparency so that all providers within the VA system know what the course of treatment is across all sorts of specialty care that are provided. This is one very specific example for mental health care, but we see this happen in other forms of care as well.
Now, you touched upon the problems that we're having with electronic medical records. My other subcommittee is technology modernization, and I really hope that we can have a joint hearing so we can be discussing this together. And so I know we already have strains in even getting the VA's system up to task and up to snuff. So I know it will be challenging for us to do that with community care. But do you have any recommendations that you can give us when it comes to electronic medical records?
I think we do need to take a very close look at the current implementation of electronic health records within the VA. We know it is plagued with problems from the get-go. This is an area that I am new in this seat. I've been a CEO here for a month, but it is one of the things that I have really wanted to dive into to be able to provide those better recommendations to you all as to how we can effectively modernize the VA and create better synergies and more seamless communication between VA and community care, and would love to work with your office to do just that.
Thank you. I want to pivot a little bit over back to our home health issues that are happening. So when I was the CEO of a healthcare company, what we did, we also had rural areas, Clewiston, Belglade, and we were servicing there. We had huge issues when it came to recruiting healthcare professionals to get out there, but also we did have a good number of Medicaid recipients. Now, do you have any Medicaid recipients who are actually with your organization?
We have very little in our particular organization. We're a standalone home care agency.
So right now we're looking at $1 trillion in cuts when it comes to Medicaid. And so I have deep concerns about the compound effects with the cuts that we have in the VA combined with the $1 trillion in Medicaid cuts, and how we're going to keep organizations like yourself who play such an imperative role in making sure that our veterans can actually retire at home with dignity with their family, but still get their services. So could you touch on some of those effects for your organizations, other home health cares, agencies that will be servicing our Medicaid patients and our veterans?
Sure. Of course, as I stated, our particular payer mix, we have very little of the Medicaid. And so for us personally, it won't have a large impact. What we do is as with any other agency, is we try to meet everybody's needs. In our particular area, we're not hearing feedback.
Well, I have
yet
a
on
few
that.
more seconds, and I just wanted to ask you this one question. One of the things I'm hearing from home care agencies is that they have real concerns about the people who are going to be kicked off of Medicaid. They can't abandon those patients. How do you transition that person who is homebound, cannot get up, can't take care of themselves? How do you rip their insurance, and how do you leave them there? So have you guys thought about that transition process? Are we just going to abandon these patients to leave them to themselves?
Well, if I can circle it back to the VA, we are actually actively seeing that now with our veterans, where on the VA services, where they've lost homemaker services, home health aid services due to internal cuts within the VA, we are seeing that they've lost access to care. And so I think it's already happening within the VA, but this started a year ago based off of decisions within the VA.
So the compound.
Thank you very much. Your time has expired.
Thank you.
The chair